Can scoliosis keep you from playing sports? Before we talk about sports and how and what sports can be affected by scoliosis, let's first discuss why staying active is beneficial for scoliosis patients and why is it beneficial during treatment and conservative treatment options in particular. So first thing, we understand that the benefits of a healthy diet and lifestyle are very amplified for patients that are dealing with health challenges, especially ones like scoliosis that can affect the entire function of the body and are normally with you for your entire life, meaning there's no cure for it, meaning that you're maintaining and dealing with your scoliosis for your lifetime. Patients that are physically fit and healthy tend to have a much better mental attitude, meaning thinking more positively, and this can be very helpful when undergoing a conservative treatment model for scoliosis because, like I said, there's no cure for scoliosis. We're reducing and managing scoliosis. So having this positive mindset that's normally very amplified during physical activity can help patients that have physical activity and they're relatively fit, can really help us have a positive outlook on the treatment approach in general. Also, we know endorphins are released through exercise, and these are natural mood enhancers. And being diagnosed with a progressive condition like scoliosis can test a person's resilience. And having these endorphins released through exercise can help a patient, again, perceive and accept the treatment. And we know a body that is healthy and strong is better suited to face the rigors of treatment. So the more fit, the more healthy you are, the more likely you are to be successful in a conservative treatment model. And therefore, it is very important for scoliosis patients to be active. Now, we know sports can affect mental health, and we know the main form of scoliosis is something called adolescent idiopathic scoliosis. So when we talk about scoliosis, we want to talk about adolescents and sports because sports have a huge benefit for adolescents in terms of mental health, physical health being really part of a team, really keeping them away from unhealthy activities like lots of sitting, lots of things that are not active for them. And we know our bodies are meant to move and to be active. And the more active that children are, the more active they are as adults. And we know it leads patients to more a healthy lifestyle. But adolescents that face scoliosis sometimes face additional challenges when they look at how their peers look at them in terms of their posture. But it can also affect the way they feel like what sports they can participate in, which one they can't participate because they could be scared of which ones could possibly affect them and not. So they don't know which ones to avoid with caution and which ones not to. But we also know adolescents that are involved in sports, it can give them a very strong sense of identity, meaning the sport themselves can help give them a sense of accomplishment by accomplishing sports and being good at them. So what sports are safer for patients with scoliosis? We know sports that are more symmetrical tend to be better. Ones that work muscles symmetrically on both sides of the body that are ideally worked evenly are most ideal. Swimming comes to mind. In fact, swimming used to be a treatment for scoliosis. We said patients were diagnosed with scoliosis many years ago. They said, just start swimming. That would help fix it. Well, we know that's not true. But in general, in swimming or being in a water environment can help, especially with patients that have scoliosis and they're in pain, because it helps decompress the spine. It can help some joint relief and can be helpful for spinal discs. It can also help patients work muscles more symmetrically, but there are some strokes involved with swimming that we don't always recommend for scoliosis patients, especially if they think they're a progressive nature, and especially if they don't have a treatment model that they're following. That's when we think sports can have a greater effect. We know walking and running for shorter distances can have a positive effect. We definitely recommend avoiding long distance or repeated shocks to the spine. We don't like that. They can lead to more strain to the spine and work out muscles and causes a compression, which we don't want to see. We also know road cycling could possibly be a safe, low-impact exercise for people with scoliosis. But when we think of what patients with scoliosis should avoid, we normally should kind of think of what types of activities can affect or deal with the body in an unnatural and asymmetrical way, or overuse one side of the body, we're not using the other side of the body, or involve repeated jarring or compression motions to the spine, which can actually lead to more scoliosis progression. So the first thing that comes to mind is something that has collision, like collision types of sports, like hockey, football. These should be approached with caution. Now, let me say something very clear, is that scoliosis patients are not fragile, meaning it doesn't mean if they participate in these things that they're going to hurt something or the curve is going to always progress. We just don't know. But the impact can cause spinal injury and strain. And what I normally like to have my rule of thumb is if a patient is not involved in an active treatment option that can undo some of the things that are happening during some of these sports I'm about to mention, and they're just doing the sport is more likely to affect them. Also, sports that become more competitive, meaning they're doing them more often than recreationally, meaning if somebody were to swim once a week in their backyard pool for 30 minutes, as opposed to swimming for 3 hours a day, every day training for meets, it's a different level. So we say when I'm talking about sports, we're talking about competitive style sports that can have this type of repetition going on. One big thing we tend to see is gymnastics, because gymnastics involves two things. It's collision, meaning you're colliding with the floor because you're fighting gravity. And it also involves a movement we call hyperextension of the thoracic spine. Hyperextension involves making the thoracic spine less kyphotic, meaning more lordotic. And this hyperextension, or this position of the thoracic spine, we think can be a predisposed factor for spinal or scoliosis progression during adolescent stage. So it's one thing that we're concerned about. Now, I see many patients that do gymnastics and do like dance. We consider these things very similar, that if they're compliant with their therapy and their home care and everything we've asked them to do, they normally can participate in these things, maybe in a limited time frame during the time of treatment. But it's patients that are not doing any type of treatment, that are doing this in a competitive manner, we believe it can have an impact on what scoliosis could be doing. Now, am I saying that these sports are going to cause scoliosis? More than likely not, but they can lead to some progression or make a curve become bigger than it needs to be if they're doing it during this stage. Golf, tennis, bowling, these are very clear examples of overusing one side of the body. This could exacerbate some asymmetry. But there are some studies that say that, they did a study with tennis players and said that they don't really know how much tennis will affect the scoliosis. Because no two curves progress exactly the same, it's almost impossible to study. Meaning if I took a group of scoliosis patients that play tennis and took a group of scoliosis patients that didn't play tennis, since no two people ever progress the same and there's no way to predict how much a curve is going to progress, there's no way to know how much impact a sport will have. But it just makes sense that if you have a thoracic scoliosis and you're using your right hand all the time to hit a tennis ball, it possibly could exacerbate that. So therefore, we look for more symmetrical type of exercises. Long jump, horseback riding involve repeated jarring motions with also a compressive effect. I mean, it's pushing down. We know compression can affect scoliosis because we know patients, when they stand, their curve is bigger versus laying down. So anything that compresses, we know can possibly affect it. What are some exercises that are very scoliosis friendly? Every exercise regarding each and every scoliosis patient is very specific, meaning there's no one exercise for every scoliosis is good. Before you attempt any type of exercise or sport and you're under treatment for scoliosis, you should consult your treatment provider regarding that exercises and that sport, whether it's something that should be recommended or not. Scoliosis-friendly stretches are normally things that can affect the hip flexors, help stretch these out, to help keep these more flexible and help make the body more responsive to any conservative treatment. Rowing is a very good symmetrical exercise to work the latissimus dorsi muscles evenly on both sides. We also like planks to help strengthen the core. Side planks, front planks can help increase core strength, and they can really, without really straining the spine or creating any kind of hyperextension or any hyperflexion, and it does it in a very even manner. So that's why we like planks. And of course, clear scoliosis institute back exercises, any type of scoliosis exercises, any type of exercises that are done to help manage your scoliosis are also things that we also recommend for scoliosis patients. Being diagnosed with scoliosis doesn't mean you have to be sedentary. We want you to be active. It doesn't mean you have to have a life full of limitations. You're not fragile if you have scoliosis. The benefits of staying active are very clear, and they're actually magnified with patients that actually have scoliosis. So we want you to be active. But most importantly, the best thing to do is to be proactive towards your treatment. And the best form of scoliosis exercise is something called an SSE. An SSE is a scoliosis-specific exercise that you're guided on to help move your body into a scoliosis-reduced position and then perform activities and sports in this reduced position. Now these sports and activities that you're doing can help assist your scoliosis and help reduce your scoliosis and help progress it. And normally these scoliosis-specific exercises must be instructed specifically for your scoliosis case by somebody who's trained in how to teach you how to do these scoliosis-specific exercises, especially during things like your sports and activities or your ADLs. Those are by far the best form of scoliosis exercises. And normally, if you're consistent with your treatment program, all the restrictions that I mentioned before could be lifted, because now we're doing things to counteract the effect that some of the negative effects that those sports could have on your scoliosis over time. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.